Gut health and spinal health, exploring the link between dysbiosis and lumbar degenerative spondylolisthesis. Introduction. Chronic low back pain is one of the most common causes of disability worldwide, especially among aging adults. Among the structural contributors, lumbar degenerative spondylolisthesis, LDS, is a key condition that often emerges with advancing age, particularly in postmenopausal women. This disorder, characterized by the forward slippage of one vertebra over another due to disc and joint degeneration, results in pain, stiffness, and limited mobility. Traditionally, LDS has been attributed to mechanical and structural changes in the spine. However, recent research has begun exploring an unexpected contributing factor: gut health. A new study suggests that dysbiosis, an imbalance in gut microbiota, may play a significant role in the inflammatory processes that contribute to spinal degeneration. Understanding lumbar degenerative spondylolisthesis, LDS. LDS typically occurs when intervertebral discs lose hydration and elasticity over time. Ligament laxity, facet joint arthritis, and vertebral instability contribute to the slippage of vertebrae, most often at the L4 to L5 level. Patients with LDS frequently report lower back pain, radiating leg pain, and difficulty walking. While conservative treatments such as physical therapy, anti-inflammatory medications, and injections may offer temporary relief, surgery is often required for long-term improvement when symptoms progress. Risk factors for LDS include age, especially over 50, female sex, obesity, sedentary lifestyle, and pre-existing spinal degeneration. However, this recent study sheds light on a potentially modifiable contributor, gut microbiome imbalance, that could open new doors in both the prevention and management of this condition. New research: gut dysbiosis and spinal degeneration. Researchers from a multi-institutional team recently explored the gut-spine axis by studying 51 patients who underwent lumbar spine surgery. They divided participants into two groups: those diagnosed with LDS and those with other forms of spinal degeneration. Using imaging and 16S rRNA gene sequencing to analyze fecal samples, they investigated microbial composition and inflammatory markers. The results revealed a distinct difference in gut microbiota profiles between individuals with LDS and those without. Patients with LDS had greater microbial diversity, but also higher levels of bacteria known to promote systemic inflammation, such as Dialister, Prevotella, and Allostypes. These microbes have been linked in previous research to pro-inflammatory cytokine production and may contribute to chronic low-grade inflammation that compromises connective tissue health, including intervertebral discs and ligaments. Conversely, beneficial bacteria like Schlacia, known for producing anti-inflammatory compounds, were significantly reduced in LDS patients. This reduction in protective microbial species may lead to a breakdown in the gut barrier, triggering systemic immune responses and possibly accelerating degenerative changes in the spine. Inflammation, the common denominator. Inflammation is central to both gut dysbiosis and spinal degeneration. The translocation of bacterial byproducts, such as lipopolysaccharides, from the gut into circulation may activate immune cells in spinal tissues, contributing to disc degeneration, vertebral bone changes, and chronic pain. Over time, this low-grade systemic inflammation may impair the spine's capacity to repair and adapt, further promoting the onset or progression of LDS. Moreover, metabolic and hormonal shifts associated with gut imbalance, such as changes in estrogen metabolism or insulin sensitivity, may disproportionately affect postmenopausal women, the group most affected by LDS. These mechanisms underscore the emerging view of LDS as a condition influenced not just by mechanical wear and tear, but by systemic biological processes rooted in gut health. Potential implications for treatment and prevention. If gut dysbiosis contributes to the inflammatory burden that exacerbates spinal degeneration, then restoring microbial balance may become a novel therapeutic target. This could involve probiotic therapy with strains shown to reduce systemic inflammation, prebiotics, e.g. resistant starches or polyphenols, to feed beneficial gut bacteria. anti-inflammatory diets rich in fiber, fermented foods, and omega-3 fatty acids. Targeted supplementation, including vitamin D, magnesium, and choline, which support bone and connective tissue health. Lifestyle modifications, such as regular physical activity and stress management, both known to support a healthier gut ecosystem. These interventions could potentially complement traditional spine care approaches and reduce the need for surgical intervention. Conclusion: this growing body of research highlights the intricate relationship between gut health and spinal integrity. The study linking dysbiosis to LDS suggests that our microbial health may significantly influence musculoskeletal outcomes, especially as we age. While more research is needed to establish causation and guide clinical protocols, the findings offer a compelling case for a more holistic view of spinal health, one that includes digestive wellness as a central component. By addressing inflammation at its source and supporting a diverse, balanced gut microbiome, we may one day be able to prevent or slow the progression of degenerative spine conditions like LDS.